Thank you for joining us. Today we're going to actually talk about something because I do think there's a little bit of confusion, and that's fat loss versus weight loss. And I'm going to start off by saying that we are not a weight loss clinic. So we do not prescribe diet or exercise. We don't do anything that really makes you lose weight.
Yeah.
But what we do is we can destroy fat cells so that you can slim your body down. But there's some confusion. So Dr. Hahm had already started talking about fat and why you don't lose a lot of weight just by removing fat. And I'm going to have her talk about it again for those who just joined on. So if you already heard her once, she's entertaining. She'll hear her here.
Okay,
again.
so when people always I'm sure you guys can Google and you guys seen, if you watch Oprah a long time ago, how much fat she's lost. Like 5 pounds of fat, like 5 pounds seems like nothing, right? But volume wise, it is huge, okay? That's why you can lose fat and not lose any weight. So when we talk about Coolsculpting, Morpheus body, whatever, you're losing fat, but like there's probably ounces, not even, But it's like it takes up a lot of room in your body, the fat, okay? Muscle wise, it's heavy. So 5 pounds of muscle is a lot. But 5 pounds of fat, 5 pounds of muscle is not a lot mass wise. Yeah. But 5 pounds of fat is very, if you were to look at it, you're like, gross. It's a lot of volume it takes up. So that's why, I think fat loss is much more significant than weight loss. Like I said, I can lose, people who say like, oh, I lost a half pound, whatever, like I roll my eyes at that because like I said, I can have a good bowel movement and lose half a pound, And, honestly, if you wanted to put on weight really quickly, all you have to do is drink a gallon of water. Like I said, not advisable because you could have seizures by drinking a gallon of water, but that's 9 pounds right there that you're gonna put on. And if you remember wrestlers in high school, they spit all day because if you spit all day, you can lose some weight.
So we're not saying that you should do any of these things to lose weight.
So my whole point is that, weight loss, you could really, a lot of people will tell you to throw away the scale, right? Because, people get obsessed with weight loss and weight gain overnight, but like it really doesn't mean much. Like fat loss to me is much more significant than weight loss.
And I'm going to put a little caveat to that. I think fat loss, as far as how you look, how your clothes feel on you, and how they drape on your body. I do think that...
Which is much more, I think, significant.
From a visual aspect. But I think from a health aspect, and I'm going to, again, start off by saying that we are not a weight loss clinic, but from a health aspect, weight loss is more important. We were having this conversation about 2 weeks ago because I was telling Dr. Susanna how much weight I still wanted to lose. So during this pandemic, because I stopped eating out and, I was at home and cooking more fresh meals and et cetera, I lost about 10 pounds. And I still have more weight to lose. Between that and the Coolsculpting, though, I look like I've dropped a couple of dress sizes. And I was telling her I still need to lose more weight because for me, the weight is what hurts my knees and my ankles when I'm trying to be active. When I'm trying to hike, when I'm trying to run, my ankles and my knees get sore because I still have too much weight. So I do need to get the weight off.
I acknowledge that, yes.
But the Coolsculpting and the Morpheus that I've been doing has sculpted my body so that my shape is more to my liking, my clothes fit better, and I look the way I want to look, even though I still have to get to my goal weight.
Yes.
And so a lot of times patients will come into our clinic and ask us very specifically about weight loss. I actually had a gentleman that we had to tell him we couldn't treat him because he did have a significant amount of fat on his belly, but he came in because his knees were getting worse and he was trying to avoid knee surgery, so he wanted to lose weight. And I told him that we can make his body look better, but if his knees hurt, he actually had to do diet and exercise. And really and truly, those are the only ways to effectively lose weight. And sometimes it's one, sometimes it's the other, sometimes it's a combination of the two. And then you always should make sure that when you do it in a healthy fashion. If you tend to go into an activity too quickly, you can actually injure yourself more, and then you don't do the activity. And if you do weight loss, because there's so many different weight loss and diet gimmicks and fads that are out there, and some of them aren't healthy. Like I'm sure we've all heard about the chili and lemon one that people do eat nothing but like water with lemon and chili for 5 days, which is basically a starvation diet. You're gonna lose weight because you're not eating. You hear about all the different diets like keto, protein, things where you eliminate one thing or eliminate the other. And we've talked about this before, but whatever you do, because for me, I record what I eat every day. For Dr. Susanna, she actually does intermittent fasting.
Right, and then the whole recording I've done when I was in my 20s. I'm
did.
so ahead of the
She
curve.
was the
Ahead of,
original
yeah.
protein, low protein Atkins recording,
Yes.
portion control.
But
that
I love
was
my
her.
carbs, so
Right.
I just can't. It's not sustainable for
Right.
me.
And the key is, if you decide that you are interested in weight loss, not only do I recommend that you speak to a professional, but to realize that whatever you do has to be sustainable. So we can all do anything for 2 weeks or 4 weeks or a couple months, but as soon as we end it, if we go back to our normal habits, we're going to basically gain all the weight back.
Right.
And that's when you see that yo-yo pattern. And many of us, myself included, have been part of that pattern where you do something really intensely, you lose the weight, you look great, and then over the next few months it creeps back on again.
Right.
And then you've got to do something new again. And the problem with that is, if you do that kind of yo-yo weight loss, you actually put on more fat, and it actually makes it more difficult because you're messing up with your metabolism.
Yeah, and we don't profess to be weight loss gurus, obviously, because we're both yo-yos. But what we do know. So when she thinks she has X amount of pounds to lose, but because of her Coolsculpting and the things that she's done, like, I don't think she has. Like, I think she would be a waif if she lost the amount that she thinks she. But I think it's a visual thing. So her knees hurt, so she wants to lose weight because of that. I think she looks a lot lighter at this weight than she normally does at this weight. Because we have known each other for like over 25 years, Is it 25 now?
I think almost 25. 2006, right? No, not 2006. 1990.
No, almost 25. Yeah, almost 25 years. Yes. So I met you when I was like 23. So yeah, I'm like 47 now. So yeah. So visually she is slimmer, but weight wise she wants to lose it because her knees or whatever, and so we're not like weight loss gurus, because obviously then we'd both be like supermodel thin, but what we are though is fake it till you make it.
And part of it is also realizing,
my full Coolsculpting and stuff.
But before I actually came down to the Imperial Valley, I used to run marathons and half marathons, so it's something I did pretty regularly, and that's how I kept my weight in a reasonable area. And
but even that was for you spurts,
Right. And so then I stopped running races. I don't run very much at all anymore. And then as I get older, my metabolism slows because I eat a lot.
Yeah, because she eats a lot. Even when she was waif thin, and when she was younger, she eats a lot. So that's her. I think she doesn't realize like 5,000 calories a day is not normal. And then now she, then she realized it. But like for her, when she. I met her in medical school. Like, since then, it's not like we had all the time in the world, right? And so that's why I've known her as a yo-yoer, because, when she had time, she would do her exercises and whatever. So she was thinner. And then, we go through rotations where we're busy and she doesn't exercise. And then I see her and she's, gained a lot of weight. And so in the end, that's why, like, she's a yo-yo, because, she does a lot of times with activity, which she really doesn't have time to do, and that's been the case since I've met her, basically, right? Because we were in medical school and then residency, and then them being surgeons,
And so we wanted to make sure everyone understood the distinction, because it is an important distinction, fat versus weight. But what we do specialize in, and what we know a lot about, is fat loss. We'll talk about it briefly, because I know a lot of times people will ask us about the things that we do, which is a Coolsculpting in the Morpheus body, versus things like liposuction. The difference is liposuction is much more invasive, because you're actually putting a cannula in and sucking out the fat. The benefits of it is you can get all the fat sucked out at once, so you don't have to do multiple treatments most of the time. And then the other thing is that you see the results a lot faster, because as soon as your body heals, you see the results. The negatives is you do require the type of surgical procedure. It is invasive. If you're a person who's doing the liposuction doesn't have a great hand, you can actually have uneven layers of fat left behind. And we actually have people come into our clinic to ask us to Coolsculpt those areas where some of the fat got left behind. Other thing is you have scars on your skin where the cannula is replaced. What do you think?
Yeah, I've had liposuction, and so first off, when I do my consultation for Coolsculpting, I say, if you're willing to do tummy tuck, you don't care about the scar, and you're willing to undergo liposuction, like, to me, I say for a lot of people, go that route. The people that we have are the people who they're really shy about having surgery. They don't want surgery. They've had enough surgery. They rather do it this way. They don't want any downtime. There is downtime. I had downtime for a whole year, I have to say. And not downtime where I couldn't, after my liposuction. Not downtime in that like I was miserable, like, but I did, for the first few months, right? I was like constantly draining out the seroma inside, so the fluid that got caught. I looked not normal for a good year. I have pictures of my liposuction because there were certain areas that like looked so deformed that I was really worried. And after a year, like, evened out. But there was like, I'm someone who I don't really care. Like I'm willing to be any guinea pig, whatever. But it was something psychologically, I think mentally, I was like, oh my gosh, this is like what I'm gonna look like. And so it's not like you have liposuction and you're gonna look fabulous. Like there is downtime where for about a year maybe you may not look exactly normal, and then wearing that garment, I'm like I can't wear the garment. And so
the compression garment,
mm-hmm. Like I can't, like you have to, I think some plastic surgeons don't make you sleep in it. I was supposed to sleep in it, and it's just like I couldn't get sleep. Like it was terrible for me. Like if I do wear that garment again, like I can't do it. Okay. Now there's like different types of liposuction now, and the one of the machines that we have is the company is called InMode, and they have liposuction where it's together with the heating. Right, and like honestly, I wish like if we had time, I would love to do that for our patients, because I think it is probably the better liposuction modality that they have now. And if I'm ever willing to actually undergo it, maybe I'll try it again. I don't know, but it's not easy. The recovery time and then the whole like after effect is not easy. Coolsculpting is much easier. Yeah. It just takes time, right, to get those results.
And that's one of the reasons why we focus in the non-invasive or the minimally invasive. And so the nice thing about Coolsculpting is...
Because I'm not shy about it. I've done it all. I haven't done it, not a tummy tuck, but I've done it all. Like, I'm not shy about it,
So the nice thing about Coolsculpting, you don't have to wear a garment. You don't have to eat anything special. You don't have to change anything that you do. After you do the treatment, you just go about your normal business.
Yeah, you go back to work.
And your body breaks down the fat cells over the next 3 to 4 months, and it basically slims you down. Some people are fast responders, so Dr. Susanna, within 4 weeks.
No, it's only in certain areas.
She saw a response. For me, I don't see anything for 10 to 12 weeks, and so it takes me the full 3 months. And then with the Coolsculpting, frequently you have to do multiple applications on a given area, because anywhere where you can pinch, the Coolsculpting will actually decrease the fat about 20 to 30%, depending upon the individual. So you can get pretty good results, but depending upon where you start and where you end up, you might want to do more. The other thing that sometimes people don't understand is there's pinchable, squishy fat, and then there's the hard fat, or what's also known as the visceral fat, where it sort of pushes your belly outward. And so it used to be that we could only treat the squishable fat, the things that we could pinch. Nowadays, we still can't treat the visceral fat, which is the fat around your organs. Again, diet and exercise to decrease that fat. But we can't actually decrease the girth of how much fat is on the outside, even with the applicators that we have. So the technology has actually moved forward quite a bit. And then we also have the Morpheus body, which is probably my new favorite procedure. I've been doing a lot of it. I've had it done on myself. Dr. Ham's had it done on herself, as well as many of our staff, and as well as a lot of our treatments. And the difference is, for a lot of people, especially if you've had weight loss, or especially if as we get older, your skin's just sagging, there's not a lot of procedures that effectively tighten skin. Number one, most creams won't make a huge difference. You might notice a little difference, but you put it on every day, a year later, it's a little tighter, but it's not noticeable. Dramatically, I mean. And then the Coolsculpting will tighten it a little bit, but not a lot. And so the radio frequency, which is one of the more popular modalities for delivering energy safely, is one of the best ways to tighten skin. And so the great thing about the Morpheus body is not only can you remodel the fat, so it's fractional fat ablation, but you can also then tighten the skin, and it is dramatic, night and day, how much that skin tightens up.
Yes, so... once upon a time, people who've had, 10-pound babies or, 10 babies, and they had that, they may be thin, but they have that.
10 babies? Yeah, I know. But
we know people who've had,
all right,
like 30 babies.
Well, patients, I don't know them, but yes, okay.
Well, you know them.
Okay, I've met them. All right, continue.
Okay, so you know what I'm talking about. The loose skin. Once upon a time, we used to tell people, there's nothing you could do about that loose skin except for tummy tuck, so that people have their mommy makeover, right? And so now there's, after Morpheus, it has changed. It's a game changer,
Mm-hmm.
because it will change, it will tighten the skin. And is it going to be still as good as a tummy tuck? No, you know. But I like personally, I never wanted a tummy tuck if I even need it. Like I mean, I kind of have loose skin, but you know, I would never get one because I thought like I don't want to be tight as a drum. Although you know that's gotten better too, but also I don't want that big scar, right? And so is it going to be as tight as a tummy tuck? No, but is it significant? Yes. I mean, we have pictures of patients that we've done who have like hanging skin with stretch marks, who, you know, on pictures look basically normal again, you know?
Absolutely.
Now those same people, can they still jiggle their skin, you know, if they were to like jump up and down? Like, yeah, it's not gonna be as tight as a tummy tuck, but is it significantly better? Like, yeah, you know?
And it's pretty dramatic because for me, I've had surgery like on my knee before, and I've had other medical procedures. I don't really want to, at this point in my life, have a surgical procedure for aesthetics. Nothing wrong with it. I just don't want it for me. So for me,
because remember, guys, she's someone who maybe like 10 years ago, whatever it was, said she wasn't gonna Botox because she was gonna age gracefully.
Because, you know, the natural blonde.
Right.
And so for me, I love the fact that there's so many minimally or non-invasive options, and they work perfect with me. I love the Coolsculpting. Actually, everything that we do at our clinic, I think she and I have both had done to ourselves, and then our favorites we keep doing multiple times.